Hello everyone, welcome to LUMP's special lecture series featuring tongue diagnosis, second lecture of 4. Today we shall talk about tongue moisture and tongue coating. The level of moisture of the tongue, which is the tongue body and the tongue coating, is an important aspect to get an accurate diagnosis. Mainly, it has to be distinguished between the dry and the wet tongue. These signs are unmistakable, in contrary to the pale tongue body. The moisture of the tongue body or of the tongue coating can differ from the normal tongue. A dry tongue always points to blood or yin deficiency. If the tongue body is pale, blood is deficient. If the tongue body is red, yin is deficient. In both cases, there are not enough body fluids to moisten the tongue. A wet tongue is always a sign of dampness. If the tongue body is pale, the dampness is caused by qi deficiency or yang deficiency. If it is qi deficiency, the transformation of the fluids by the spleen is deficient. Murky fluids, dampness are created. The spleen then transports the murky juices upwards, and so the tongue gets wet. If the tongue body is red and wet, there is dampness in combination with heat in the body. This heat reddens the tongue body. If the tongue body is also wet, the transformation of the body fluids must be damaged. There are two mechanisms which can be the cause. Liver fire and spleen yang deficiency can be present at the same time. Liver fire reddens the sides of the tongue, and spleen yang deficiency leads to dampness and turns the tongue wet. With heat, there is the danger of dryness. The organism can produce dampness as a wrong compensation of the dryness. Let us consider the case of a 34-year-old male as an example. The color of the tongue body is red, signifying heat, and the tip of the tongue is pale with wet areas. Heart yang deficiency. The wet tongue body signifies spleen yang deficiency and dampness. No coating, yin deficiency. Cracks all over the tongue body means there is yin deficiency of kidneys, heart, lungs, stomach, and liver. The multitude of cracks are conspicuous, signifying deficient yin of the whole body and the kidneys. At the same time, signs of dampness and yang deficiency are present at the area of heart and spleen. The patient must be treated for a long period and his yin of kidney tonified. With this kind of cracks, it can be supposed that there are problems for a longer time, and this patient had problems probably for over 20 years. Now let's go to tongue coating. With the examination of the tongue coating, color, thickness, and distribution of the coating play an essential part. The tongue coating also provides information about the kind and the depth of the pathogenic factor by acute infections. The meaning of the localization of the tongue coating corresponds to the meaning of the localization of the tongue body color. The color of the tongue coating can be white, yellow, gray, or black. White coating. A thin and white coating without any other pathological symptoms is normal. A white coating points to cold. Yellow coating points to heat. Gray coating can develop from white or yellow coating. The coloring doesn't indicate a heat or cold problem. If you have a tongue with a gray coating and black coating, it means that the disease exists for a longer period and additional symptoms are necessary. If a gray coating is dry, there is heat. If a gray coating is wet, there is cold. A black tongue coating can develop from a white, a gray, or a yellow coating. The coloring doesn't inform whether it is heat or cold problem. A black coating, just as a gray coating, shows that the disease exists for a longer period and additional symptoms are necessary. If a black coating is dry, there is heat. If a black coating is wet, there is cold. A tongue coating can be thick, thin, without root, or absent. A thin coating is normal if the color of the tongue body is still visible. Exception: look at the tongue coat with acute infection. Thin coating is also physiological, that the tongue coating is slightly thicker at the center and the back of the tongue. A thick coating points to phlegm. A chronic thick coating points to phlegm unless there is an invasion of a pathogenic factor. A thick and white coating points to phlegm and cold, and a thick and yellow coating points to phlegm and heat. Additionally, a thick coating can be slippery, sticky, or oily. These consistencies develop as a result of the phlegm. If the coating is like powder, this points to phlegm with heat. Rootless coating. A normal coating is linked to the tongue body. It cannot be wiped or scratched off. Such a coating has a root. A rootless coating can be scratched off because it lacks a root. Here you can see the difference between a tongue whose coating has root and a tongue whose coating has no root. It occurs when, because of a yin deficiency, the coating is not reproduced. A rootless coating points to yin deficiency. Absence of coating points to yin deficiency. This is generally known as a tongue looking like a map, or what we call the geographic tongue. This can be the consequence of a rootless coating. The coating disappears at some places and the tongue looks like a map. Tongue coating changes if a pathogenic factor penetrates the body. Thickness of coating shows intensity of pathogenic factor. The thicker the coating, the more intensive the pathogenic factor. It must be distinguished from chronic developed coating, and additional symptoms must be used to get precise diagnosis. Localization of coating with acute infections differs from the general meaning of the localization. By acute infections, the tip of the tongue and the front margins refer to the external body. If there are changes in this area, the pathogenic factor penetrates the Wei Qi. If the changes are behind this area, the pathogenic factor penetrates the body more deeply. If wind cold penetrates the body, the coating gets thin, white, slightly wet. Localization of coating is in the first third or front third or at the sides of the tongue. If wind heat penetrates the body, the coating gets thin, yellow, rather dry. Localization of coating is in the first third or at the sides of the tongue. External cold can directly affect the stomach, large intestine, bladder, and uterus. In these cases, the cold directly strikes the inner body without passing through the external body. In each of these cases, the coating is thick, as a sign for a pathogenic factor in the inner body. It is thick, white, and maybe wet because cold leads to stagnation of the fluids. The more intensive the pathogenic factor, the thicker the tongue coating. The deeper the pathogenic factor, the more central is the localization of the coating. Now let's go to the following examples. Case number 1 is a 46-year-old female. As you can see, the tip of the tongue is a bit red, so this would mean heart fire. The sides of the tongue body are pale, indicating liver blood deficiency, and the tongue body is reddened at the root of the tongue, truly reflective of kidney yin deficiency. The tongue body is swollen, which represents dampness. The tongue coating is yellowish and greasy, signifying phlegm, heat. No coating at the sides and at the root of the tongue. That means we have a geographic tongue or a map tongue, yin deficiency. The slight crack in the area of the lungs indicates lung yin deficiency. The coating at the posterior third existed as well. It was the heat that removed the coating, causing the tongue to look like a map, therefore leading to yin deficiency. The tongue is swollen, which reflects dampness. So the dampness could be either due to spleen-yang deficiency or dampness wrongly compensating for the yin deficiency. Treatment principle: tonify the yin of the heart, the lungs, liver, and expel the phlegm and dampness. Tonify spleen-yang. Case number 2, 70-year-old female. The tongue body color is red, signifying heat, and the tip of the tongue is reddened, which means heart fire. The patient has a long tongue, which means there is heat. The sides of the tongue body are flattened, signifying liver yin deficiency, and the tongue is slightly deviated to the right, very indicative of wind. When you look at the tongue coating, it is yellowish at the area of the lungs, which means there is phlegm heat in the lungs. There is no coating at the center, indicating stomach yin deficiency. Take note of the long vertical crack, okay, with little cracks in the center, signifying stomach yin deficiency. The heat and yin deficiency are caused by kidney yin deficiency, which is spread to the rest of the body. Depending on the symptoms, the yin of the corresponding organs has to be tonified, and the phlegm in the lungs has to be expelled. Case number 3 is a 42-year-old male. Again, the tongue body is red, signifying heat. The tip of the tongue is reddened, heart fire, and the tongue body has flattened sides, which means liver yin deficiency. When you look at the tongue coating, it's yellowish at the right area of the lungs. This means phlegm, heat in the lungs. There is also a yellowish coating at the root of the tongue. So phlegm, heat in the lower burner. Vertical crack extending up to the tip of the tongue. Stomach yin deficiency, lung yin deficiency, and heart yin deficiency. Now the coating at the area of the lungs is amazing because it occurs isolated. So it indicates phlegm and heat in the lungs, which has to be expelled. The tip of the tongue is red, indicates an emotional disorder in the heart and lungs. And the spirit or shen of this patient has to be calmed, and one has to tonify the yin. Case number 4, we have a 47-year-old male. The tongue body is red. Again, this is heat. And it has a thin tongue body in the middle area, very indicative of stomach yin deficiency, lung yin deficiency, and heart yin deficiency. The tongue coating is yellowish at the root, indicating phlegm heat in the lower burner, and in the middle of the tongue, phlegm heat in the stomach. You can see a vertical crack extending up to the area of the lungs. So this would mean stomach yin deficiency and lung yin deficiency. Besides the red tongue body and the vertical crack, the thick yellowish coating at the back third or the posterior third is most conspicuous. Phlegm heat must be expelled from the bladder and large intestine. Following or in combination, the yin of the stomach, lungs, and heart has to be tonified. We go to case number 5, 68-year-old female. Color of the tongue body is red, signifying heat. The tongue body is thin in the front third, indicating heart yin deficiency and lung yin deficiency. The sides of the tongue body are slightly swollen, signifying dampness and heat in the liver and gallbladder. The tongue coating is grayish black and slimy coating in the back. There is phlegm in the lower burner. There are slight cracks in the middle, indicating stomach yin deficiency. The grayish coating at the posterior third means there is history of disease. because this grayish coating is on a red tongue body, so this points to phlegm and heat. Phlegm and heat have to be expelled, and obviously the phlegm develops from dampness. Dampness has been burned to phlegm by heat. If the cause of heat is yin deficiency, one has to tonify the yin after expelling phlegm and heat. Case number 6. The color of the tongue body is pale and rather dry, indicating blood deficiency. The tongue body has swollen sides, which signifies liver qi stagnation. The tongue body is also divided and rolled under the tip of the tongue, indicative of heart yin deficiency. The tongue coating is white, indicating cold, and tongue body is partially swollen, which means dampness. So the swollen sides indicates stagnation of liver qi. Therefore, one has to move the liver qi, because liver qi stagnation has created heat, damaging the heart yin. The divided tip of the tongue indicates heart yin deficiency, and additional symptoms are necessary to decide whether this is important for the treatment. Then we also see signs of dampness and cold, which means that one has to expel the dampness and the qi tonified. The result of treatment has to give information on the accurate treatment principle. Now let's look at tongue number 7, belonging to a 44-year-old female. Color of the tongue body, not significant because it is pale red. The tongue body is thick and swollen, signifying dampness. We see tooth marks indicating spleen qi deficiency. And the tongue is partially without coating, indicating yin deficiency. We also see slight cracks in the lung area. So slight cracks means onset or the beginning lung yin deficiency. So the tooth marks and the thick swollen tongue points to spleen yang deficiency in combination with dampness. The yang of the spleen has to be tonified, and one has to expel the dampness. One has to pay particular attention to the yin deficiency, because by tonifying the yang, you could worsen the yin deficiency. Let's go to tongue number 8, belonging to a 72-year-old female. The color of the tongue body is insignificant because it is pale red, and the tongue has no coating at the sides and the tip. So very indicative of liver blood deficiency, heart blood deficiency, and lung yin deficiency. We notice cracks at the sides and the middle, which would tell us there is liver blood deficiency and stomach yin deficiency. Okay, so what we could see here obviously are the cracks and the missing coating, and therefore we need to tonify the blood or yin of the liver and the stomach. We go to the next tongue, belonging to a 38-year-old female. The tongue body is reddened, which is indicative of heat, and the patient has a large tongue, which also means there is heat, and we see no coating at the sides. So this is very indicative of general yin deficiency or liver yin deficiency. Okay, what is very conspicuous here is the deep vertical crack. This is stomach yin deficiency. Also, we see cracks at the sides, and this is very indicative of liver yin deficiency. Then we see cracks at the tip of the tongue, which is very heart yin deficiency. So this tongue shows many signs of yin deficiency. Therefore, one has to tonify the yin of the kidneys, the stomach, the liver, and the heart. Thank you very much for your attention.